Hello, and welcome to the Baby Basics portion of the Bundles for Babies class. I'm Cindy Blue, and I'm the New Parent Support Nurse for Davis-Monthan. If you're not familiar with New Parent Support Services, we're here to do just that, support new parents. To qualify for our services, you have to be a TRICARE recipient, you have to be pregnant, or have a spouse or a partner who's pregnant, or have a child in the home under 3 years old or 36 months. New Parent Support Program, also known as MPSP, consists not only of myself, but of a whole team of people. We have social workers, and we have program assistants, and we have a domestic violence advocate. Our contact number is 520-228-2104. Don't worry if you didn't catch that number. I'll repeat it several times throughout this program. The focus of this class is the baby's here, now what? Whether you're a first-time parent or you've had a few, good information is always helpful. We're going to talk about breastfeeding and bottle feeding, the period of purple crying, what to do about the crying, as well as what not to do, postpartum depression, plus several other things along the way. If you have questions about the content of this class, or you are interested in signing up for the New Parent Support Program, please give us a call at 228-2104. Our entire team is here to help, and we're waiting for your call. Now let's talk about feeding your baby. It's true that breast milk is best for babies. The American Academy of Pediatrics recommends that babies are breastfed for the first 6 months of life and then up to a year, along with appropriate introduction of solid foods. There are many benefits to breast milk, such as increased immunity to infections, lower rates of asthma, easier digestion, and lower rates of SIDS. Also, breast milk is free. The cost of formula can add up pretty quickly. But although breastfeeding is natural, it's not always easy. It's not uncommon for new moms to need a little help to get the baby to latch correctly. Without a good latch, nursing can be painful and frustrating for both mom and baby. Here are links to a couple of videos that may better explain how to latch the baby for a more effective nursing experience. Most new breastfeeding moms want to know, is my baby getting enough to eat? Some of the ways you can tell are, is a baby nursing 8 to 12 times per day, and that's in a 24-hour period? A newborn infant will nurse every 3 hours, start to start. Does he or she have at least 6 wet diapers a day? And newborn babies can have more than 6 wet diapers in a day. They can go through a lot of diapers. Are they sucking and swallowing while they're nursing? Can you hear the baby actually swallowing the milk while the baby is up to the breast nursing? Do they seem satisfied after they've finished a nursing session? Are they passing stools? And remember, babies' tummies are tiny. On the first day, a baby's stomach holds about 1¼ teaspoons. By day 3, they hold about 1¾ tablespoons. And by day 10, babies' tummies hold about 4 tablespoons. So it doesn't take a lot of breast milk or formula per feeding. Here's a chart to help you calculate how long that breast milk is good for. At Tucson room temperature, fresh breast milk lasts about 3 to 4 hours. In the freezer, breast milk can be frozen for up to 6 months, and in the deep freeze, it can be frozen for up to 12 months. There may be times when you want to offer baby a bottle. You can feed either breast milk or formula via the bottle. A bottle is a nice way for mom to get a break, and it's a great way for the other parent or another relative to bond with the baby. If you do plan to breastfeed, it is recommended that you get breastfeeding well established before you offer a bottle. Well established can mean 2 to 3 weeks of exclusive breastfeeding. Some babies can switch back and forth from breast to bottle without any problem. Other babies have a definite preference. Some moms choose to bottle feed or have medical or other issues that preclude them from breastfeeding. The most important thing is that we feed the baby. How you choose to feed the baby and what you choose to feed the baby is a personal choice. The New Parent Support Program is here to help you no matter what choice you have made. Lactation consultation and breast pumps are TRICARE covered benefits. Because breastfeeding can be challenging, if you're having difficulties, I encourage you to seek professional advice. You are authorized up to 6 sessions of breastfeeding counseling and no referral is needed. All of our Tucson hospitals offer lactation services as well as milk and honey. For an up-to-date list of current Tri-West authorized service providers, please contact HealthNet Federal Services. If you're not sure how to get help, please contact us. Although we don't have a lactation consultant on staff, as the New Parent Support Nurse, I'm available to answer your questions as well as make suggestions on comprehensive community services. Remember, our number is 520-228-2104. Let's talk about poop. The first stool that a baby has is called meconium, and it's black and tarry, and it can be quite sticky, so wipe gently when you change the baby's diaper. The next stool is transitional, and it does look a bit like green pea soup. Once the mom's breast milk comes in, breast milk poop is yellow. It can be smooth or it can be grainy, but it is yellow, and sometimes that surprises parents if they weren't expecting it. Those multitude and seemingly endless amounts of well baby checks, are they really that important? Yes, they absolutely are. Please do not miss your well baby checks. Well baby checks give your baby's medical provider so much information about their growth and development. Baby will get a head-to-toe medical exam. You'll stay up to date on your baby's vaccine schedule, and it's also a great time to ask questions about any concerns you might be having. And if there is a problem, you and the provider can work to correct it right away. Please don't skip your well baby checks. Here is an example of a growth chart. Your baby's weight and measurements will be charted at each visit to make sure she is growing and developing as she should. Caring for a sick child can be stressful, especially when that child is a baby and he can't communicate with you about how he's feeling. Sometimes, when you're dealing with a crying baby, it can be hard to know if they're sick or just going through a developmental stage. Here are some indicators that your baby's medical provider should be called. If your baby's running a fever, and that's defined as a temperature greater than 100.4, not 104, 100.4. If they're just not feeding very well, they're not taking the breast as often, or they're not taking as much formula from the bottle. If they're vomiting, not spit up, but vomiting. If they're having diarrhea. This sometimes can be hard because normal breast milk poop is yellow and runny. If they break out in a rash. If they're having a discharge from their eyes. If they're coughing. Fewer wet diapers, and especially if the diapers have a stronger odor, it can mean the baby's getting a bit dehydrated. Or, of course, if you have any concerns about your baby's health, then you should contact your medical provider and ask those questions. What is the period of purple crying? And more importantly, what do I do with this crying baby? We know that from about 2 weeks of age until 3, 4, and some babies even 5 months, that all babies cry more. Some babies are easier to console and parents don't perceive an increase in crying, but some babies can cry a lot. The period of purple crying is a way to educate parents and caregivers about this developmental phase and better identify and understand the impact that the crying can have. Purple is an acronym, with the first P standing for the peak of crying. This is a period of time in which your baby is going to cry more. It can be unexpected. This crying can come on for no apparent reason. It can resist soothing. You can sing to your baby and rock your baby, try to feed your baby, but sometimes this crying, you just can't soothe the baby no matter what. Other P is for pain-like face. Sometimes the babies look like they're in pain, even when they're not. The L is for long-lasting. Babies can cry for hours. Not all babies, but some babies this period of purple crying hits them especially hard. And the E is for evening. These bouts of crying tend to cluster more in the late afternoon and evening, which of course is when you are the most tired as well. I encourage you to visit the don'tshake.org website for some excellent information on the period of purple crying, what you can do, how to identify it, and how to help your baby and yourself. The most important thing is don't shake that baby. There are a number of programs out there offering parents tips and tricks to soothing a crying baby. Many of them include swaddling, walking, pacifier, rocking, singing, or a warm bath. I particularly enjoy Dr. Karp's Happiest Baby on the Block methods. You can find him online, as well as many others. And remember, you cannot spoil an infant. Ultimately, if you've tried all the tricks and you're feeling frustrated by the inconsolable crying, put the baby in a safe place and walk away. Never, ever, ever shake that baby. The consequences can be devastating. If you have questions about caring for your infant, or you just want to vent about your frustrations, please give us a call at the New Parent Support Program. Again, that number is 520-228-2104. Included in this slide is a video that better explains the damage that can be caused with a shaken baby. I encourage you to check it out. When you finally do get your baby to sleep, where should your baby sleep? Well, the Arizona Department of Health gives us a checklist on safe sleeping with infants. You can share your room with the baby, but not your bed. Don't smoke near your baby. Keep all the bedding away from baby's face, and that includes blankets and stuffed animals and pillows. We don't want that baby's face to get up against anything. Make sure that the sheet is tight-fitting and the mattress is firm and new. And don't overdress the baby. If you're comfortable temperature-wise, so is the baby. These safety measures have greatly reduced sudden infant death syndrome as well as sudden unexpected infant death syndrome. Both of those are explained by the National Institute of Health as well as the CDC. Please check out those websites for more information and safe sleeping with your baby. Even if your baby doesn't like his first bath, most babies will grow to enjoy it. The warm water and your full undivided attention make bath time special and fun. This slide lists some bathing tips as well as gives a link to a video that demonstrates giving an infant a bath from start to finish. Most importantly, remember to never leave that baby unattended anywhere near water. If something distracts you in the middle of the bath, bring the baby with you or take the baby out of the water and put the baby in a safe place. Happy bathing! Most of us have heard of the baby blues, which are common and often manifest as mood swings and crying and anxiety for the first few weeks after a baby is born. But let's be real, having a baby is tough. You have just gone through the experience of labor, you're trying to heal, and you're getting to know this new person. Many of us are trying to learn how to breastfeed, and you certainly aren't sleeping. A newborn baby needs to nurse every 3 hours, start to start. No matter who you are, the postpartum period is exhausting. Postpartum depression affects 1 in 5 new moms, and the symptoms range from feeling angry or sad or hopeless or even anxiety and panic. Please know that if you experience these symptoms, you're not alone and there is help. Whether you are active duty or a family member covered under TRICARE, there is help for postpartum depression. You can give us a call at the New Parent Support Program, 520-228-2104. There's also a list of other services available both on and off base. And remember, if you are a family member covered under TRICARE, you do not need a referral to seek counseling services. For an explanation of your benefits, please visit TRICARE. The most important thing is, if you are experiencing postpartum depression, please reach out and get help. I'm Cindy Blue, and on behalf of the Davis-Monthan New Parent Support Program, we are here to help. Please don't hesitate to reach out to us at 520-228-2104 and tell us how we can better support you. Davis-Monthan New Parent Support Program, we're here keeping healthy families on track.